Hi, I'm Candace, Global Trainer from TopCon Healthcare University. Entering autorefractor and Lensmeter data into your digital phoropter is really beneficial for your refraction workflow. Loading autorefractor data into the CV5000 gives you a starting point for your subjective refraction, whereas loading Lensmeter data enables a quick and easy comparison between the final refraction and the patient's previous spectacles. Let's look at the two methods for adding this data. The first method is to digitally import data from your autorefractor or computerized Lensmeter. Talk to your local TopCon supplier if you do not have these devices connected to your digital phoropter. As soon as measurements have been captured on these devices, the data is available for import. Press the blue In button to see the available autorefractor or Lensmeter data listed on the data input screen. On the left is the AR or autorefractor data. On the right, you will see the RX or computerized Lensmeter data. Often, you will be importing the most recently measured patient data, but if your pre-test room is connected to multiple phoropters in different exam rooms, you will need to select the correct patient from the list of patients measured that day. When you select and import the autorefractor data, it is displayed in the upper left reference data area. Selecting the correct Lensmeter data from the RX data list displays it in the upper right reference data area. There are set to subjective checkboxes in both AR and RX reference data areas. Check one of these to select which set of data you want as the starting point for your subjective refraction. Select OK, and the selected data will appear in the middle of the main data area. You will hear the phoropter head load the selected lenses. Now you are ready to begin your subjective refraction. If your autorefractor and/or Lensmeter is not connected to the CV5000, you can easily enter the data manually. Let me show you how. First, you will need your data from the autorefractor or Lensmeter. This printout happens to be from the autorefractor. Locate the data drop-down menu at the top middle of the screen. Normally, this displays the data values currently in use during the refraction. However, the title is also a drop-down menu. Select to reveal a list of data values that can be loaded into the phoropter. Choose the Unaided button. This will temporarily clear any data from the phoropter head. One eye at a time, select the S, C, and then the A data areas. In each area, input the values from the autorefractor printout using the dial controller. Once data for both eyes have been entered, select the data drop-down again to open the drop-down menu. Now, hold down the Shift button on the keyboard at the same time as selecting AR. This saves the data as AR data and loads the appropriate lenses into the phoropter. If you want to enter Lensmeter data, repeat the process by selecting Unaided from the data drop-down menu. Enter the measured Lensmeter values and select Shift and RX together to save the Lensmeter values to the RX title and to load the appropriate lenses into the phoropter. To decide if you want to begin your subjective refraction with the autorefraction or Lensmeter data, select AR or RX from the data drop-down menu. We'll choose AR. When your chosen starting refraction values are displayed, select the subjective option from the drop-down menu. This will load the AR autorefractor values as the subjective data in the phoropter. You are now ready to refract the patient. With the Lensmeter data stored in the CV5000, it is quick and easy to demonstrate the benefit of the new refraction compared to their previous spectacles. This is your new prescription, and this is your current spectacles. Which do you prefer? And that's how to enter reference data into the CV5000 to speed up refraction and to enable a quick comparison of the new and old prescriptions. For more information on the CV5000 digital phoropter system, please visit TopCon Healthcare University.